All right, welcome back, everybody. Another episode of the Psych podcast. Today, we're excited to introduce our guest. We have Dr. Paul Gray here with us. He is a fellow psychiatry resident physician. Here to share a story. Paul, please give a brief introduction and welcome to the show.
Yeah, thanks for having me. My name's Paul Gray. I'm a DO resident, Psych PGY2 resident at the Vineland Inspira residency in South Jersey. Part of the inaugural class there. Last year was my first year starting off in residency and started off in a brand new residency program there, which, as you all know, we're kind of it's kind of a sister program to your all's program. And yeah, happy to be here. Thanks for having me.
Awesome. So sister program, what that really means is that our residency programs, although we're not in the same residency, we do have a partnership. So we've crossed, Dr. Logan Noone and I, and with you, Paul, our paths have crossed many times. We'll continue to cross as residency progresses. And you actually shared your story with us about a year ago now. It's crazy how time flies. But you had quite a compelling story, and I felt like your story, just how powerful it is, how impactful it is. Really excited to have this conversation with you today. So why don't we start by, I'll let you just go ahead and run with it.
Yeah. So in regards to what you're talking about, at one of our didactics sessions last year, I volunteered to talk some about recovery because I myself am a recovering alcoholic. My sobriety date is September 30th of 2009. So recently celebrated 14 years sober. And so, yeah, I decided to give that lecture because one of my goals when getting into medicine was to, first of all, one of my goals with the psychiatry residency is I'd like to do an addiction medicine fellowship after I'm done with my 4 years of residency. And early on, when I got into medical school and then got into a psychiatry residency, I really was hoping that I could do some education and share some of my story in regards to being in recovery with the medical community and be able to do some teaching and education with, medical students, co-residents, peers, residents and other specialties, and really just try and use my experience to help educate others as well as work on breaking down some of the stigma behind it. But yeah, I can kind of get started anywhere you want me to, in regards to
I do have a quick question for you. I'm just going to bounce off what you said. You said you're in recovery. Is that right? So I find that to be very interesting. You said your sobriety date was about 10 years ago.
14 years.
14 years ago. Okay. So close to 15 years now. Mm-hmm. So that's obviously a very long time. So as somebody who has this past, is there ever a point in your life where you cross over from recovery into something else, or is recovery considered a lifelong process?
For me, I view it as a lifelong process. So I got sober through a 12-step recovery program, which I still am involved with. And so I use the terms like alcoholic and in recovery or recovering alcoholic because that's the terminology used in my program. When I'm working with patients or talking in the medical setting, I use the terms like, alcohol use disorder, somebody with alcohol use disorder in partial or full remission, those kinds of, or, somebody who's actively intoxicated. I use that kind of terminology. But for myself, when I'm talking about myself, I refer to myself as an alcoholic. I refer to myself as being in recovery. So for me, recovery means that I work a recovery program. And part of that is abstaining from alcohol. It can mean different things to different people within those programs. A lot of times within the programs, we give suggestions and give advice like there's not like a lot of like hard set rules that are meant to be followed. But just for me personally, I abstain from alcohol. That means I also abstain from other mood altering chemicals, other than like caffeine, and have had my bouts with nicotine and stuff. But like, I don't use medications that aren't prescribed to me. Like, whenever I do use medications, I use them as prescribed. I don't partake in marijuana. That's just like a personal choice for myself in regards to my own recovery. If I was, partaking in that, to me, I would count that as a relapse, and I would need to get honest with myself and with my program and my sponsor, and, need to pick up a new chip and kind of get right with myself. So that's what being in recovery means to me. Like, I work a recovery program, and that's essentially how I got sober and how I stay sober.
So, I'm kind of curious, through your journey, and I actually wasn't there on the day of didactic, so I don't even really know exactly where this story is going. Okay. So this is going to be the first time I've heard this. I'm curious, did you always want to kind of pursue becoming a physician, or was it with your bout, with alcoholism, alcohol use disorder, being an alcoholic, however you really want to call it, did it evolve to eventually you wanting to pursue this path, or did you always kind of know that this was a field that you would thrive in?
So it's a bit of a story. So my dad was a physician, so I grew up in that kind of environment. He went to medical school later in life in his 30s, similar to myself. And so I grew up around it. And growing up, I just remembered seeing him and how much he worked, and just thought to myself, like, that is just way too much work. I don't want to do that. Mm-hmm. And spent a lot of my time feeling kind of lost, not knowing what I wanted to do with my life. So I was actually kind of a late bloomer when it came to drinking. I didn't really start drinking until I was like 20 years old.
Oh, interesting.
Yeah. Like I had a couple of like times, I didn't grow up in a family where there was a lot of drinking going on. I remember my dad, he would keep a 12-pack of Coors Light under like the kitchen table, and would keep 2 cans in the fridge at a time, and would have 1 or 2 at the most, every day, every other day, something like that. And we had a liquor cabinet that was like literally not even the size of like the full like plastic things that you carry around in the grocery store. When you're shopping, it was like half that size, and it had like a couple bottles with like just like small amounts in them. So there was a couple times where like, I went in there and took a couple swigs of things, and maybe like stole a beer out of my dad's out of the refrigerator, but didn't really ever seek out getting drunk or drinking until I was around 20 years old. And at that time I was in college, and I was also dealing with some depression, was feeling kind of lost in regards to not having much direction in my life. I was playing music in bands, and was getting kind of fed up with school, and alcohol entered into my life. I remember distinctly, I was upset one day over a girl, and I called my brother, who is 6 years older than me, and I was just like, hey, can you get me some alcohol? Because I just remembered thinking, like, I don't want to feel like this. If I could change how I feel right now, I would really like that. And the idea came in my mind. I was just like, oh, I should get drunk. And I called up my brother. I still remember he brought me a 5th of Malibu rum and a 5th of lemon Bacardi, and brought it to my dorm room. And I didn't really know what I was doing, so I just started drinking it straight. Got a pretty good buzz going. Didn't like get blackout drunk or anything that night, but quickly started realizing like this changes how I feel, and got me out of my head. Like I always had my head spinning. Like it just felt like, a rat in a in a mouse wheel, or a mouse in a mouse wheel, whatever. And drinking helped me calm down, helped me forget about things. I felt like I was more enjoyable to be around when I was drinking. And for me, drinking was always like very much like going towards being drunk. So early on, I didn't really have much of that gauge of like, oh, I'm going to have a couple and then I'll be good. My brother was in med school at the time. He was in med school and then going into residency. And I was a young budding alcoholic, ended up withdrawing from school. Actually pretty much failed like 3 semesters of college. Just was not going to class, and was playing in bands, working in restaurants, and drinking a lot. And it wasn't until after I got sober that I went back to college, finished my degree in psychology, and was actually thinking of going into a PhD in psychology. And my dad came down to visit me and basically said, "Have you thought about med school? And at the time I said, "No, not really. I haven't taken any of the pre-med classes." But in the back of my mind, I would always think like, I wonder if I have what it takes to do that. And my dad basically said, graduate school would be hard, medical school would be hard. It really just kind of comes down to like what you want to do. And I decided then and there, like my dad never really pushed me into medicine. He was always very much wanted me to decide for myself what I wanted to do. But I don't know, the fact that he like kind of was expressing it in me, like I kind of thought he almost seems like he thinks I could do this. And in my mind, I was like, I'd kind of like to see if I could do this as well. And it just kind of blossomed into that. And I went into med school wanting to be open-minded, but did have in the back of my mind like an interest in psychiatry, an interest in going into addiction medicine. But you do sometimes see people with going into addiction medicine relapsing a lot because they sometimes forget to focus on their own recovery because they spend so much time working with others. And so I knew there would be a little bit of a risk with that. And so I really wanted to make sure that I was getting comfortable with myself. I was getting comfortable with like med school and residency, and before kind of making that decision. Well, obviously back in med school, I had to make that decision in order to pick a residency. But yeah, it did not start off with me like always having that passion of like wanting to go into medicine. It was, I actually had quite an aversion to it for a while, seeing what my brother and my dad went through with going through med school and residency. But ultimately, after I got sober, I learned quickly that sometimes the things in life that are worthwhile take some hard work. And I had been kind of shirking responsibility and hard work for a while with my drinking, and I was ready to kind of focus on a new direction in life. Sorry, I know I'm a bit all over the place right now.
That was amazing.
That was a great little
thank you for sharing all that. Like you've certainly been through a lot, and I think you have a lot of wisdom to share with other people. I will say I am kind of shocked to hear that a lot of people that go into addiction medicine end up relapsing. And to hear you talk about the potential of relapsing, like I almost sense that you still have this internal fear about relapsing. So I find that to be very interesting. Like it's been 14 years since your last drink. Is that something that you still think about very often?
So I don't think about it very often, but so like every day I never forget that I'm an alcoholic. The thought at some point in my head goes through like every day, I am an alcoholic, and it's important for me to remember that, because if I forget that, I might end up picking up a drink. That being said, like most days, staying away from a drink is the easiest thing I do these days. It's not something that I go through on a daily basis of this lingering thought of like, oh, am I going to pick up a drink today? Like that is not the case at all. But I also do have to have a respect for what alcohol did to me. One of the things we say is that it is cunning, baffling, and powerful. And if I forget that, then I'm liable to kind of let it creep its way back into my life. And so it's something I try and have respect over. I take my sobriety and my recovery very seriously. But that being said, like, I'm at a place in my life where, and I've been in a place at my life now for a while where staying away from a drink is oftentimes the easiest thing I do.
When you think back to that period, when you had an unhealthy relationship with alcohol, I mean, after all these years, what is your perspective on, what is your reflections on, looking back on those years?
My reflection on those years, there were some good times. I mean, early on, drinking was fun for me, but it quickly turned on me. Like I said, at the age of 20, I started drinking, and probably within about 6 months, I became a daily drinker. Wow. And it progressed very quickly. Like I was drinking every day, and within probably like 2 years, I'd say I was drinking a fifth of vodka a night, on top of, several beers a day. I progressed to a daily drinker, like drinking in the mornings, drinking throughout the day. If I had a day where I tried to not drink, I would get the shakes. It got to the point where I would be getting the shakes, like, if I didn't drink in the mornings, like by the afternoons, I'd start getting the shakes, vomiting on a daily basis just from like the withdrawal. Like at the time, I just thought, man, I don't feel good. But in hindsight, I know now that it was essentially withdrawals on a daily basis. And so there were some fun times in the beginning, but when I look back on it, it was a lot of hard work. Like, it takes a lot to try and protect that, to try and protect your addiction like that. And I wasn't doing it very well. Like, everybody around me knew exactly what was going on. Like, my family, my friends, everybody was worried about me. And so, even the times when I thought I was actually like hiding it pretty well, I was not hiding it very well at all. So when I look back on those times, I mean, honestly, it was hell at times, specifically that last year of just knowing that in my heart, knowing I had a problem, that I couldn't go on doing this, like living the way I was living forever, that it was eventually going to get the best of me. And being kind of in this limbo of like wanting to get sober, but then also like struggling at maintaining any kind of sobriety back then. Like, my first time being introduced to recovery was about the age of 24. And then I didn't actually get sober until I was about a year later, until I was 25. And so I spent basically like a year. I went into like 5 or 6 detox facilities, went to treatment twice. The last time I went to treatment, I got out and moved into a halfway house and then into a sober living house. And I ended up living in a sober living house. Also, it's called like an Oxford House, is like the company or the organization. And lived in an Oxford House for like 14 months before moving into an apartment by myself. And so yeah, I put a lot of work into drinking, and ultimately then had to put a lot of work into building like a solid foundation of recovery.
Mm-hmm. So as somebody who's done the work of recovering from severe alcohol addiction, how do you think we need to reshape the way we imagine or think about addiction to alcohol? And what kind of changes would you like to see that you feel like from your experiences would be the most beneficial to the patients that we serve in terms of getting people off of substances that they're abusing.
Yeah, it's something I definitely think a lot about, and also something I think about, like, how can I contribute to that, and what can we be doing different? Like, what are we doing that's working? Some of the things I've learned over the years that I think is great is like motivational interviewing, learning how to meet the patient like where they are in terms of like what they want to accomplish. Are they ready to stop drinking? What kinds of commitments are they ready to make? Because ultimately for me, like, I was not ready to quit drinking. Like, the first time people started trying to tell me that they thought I had a problem, like the first time I was in treatment, I just remembered my counselor basically just looking at me, and she just kept being like, you can never drink again, Paul. And I was like, I think I might be able to. Mm-hmm. And she was like, no, you can't. And I was like, I'm not so sure about that. And essentially that's like all we did.
Sounds like a pretty shitty counselor.
I mean, it was, I think she was doing her best with what I was giving her, but
hey, I have a great idea. Yeah. You should stop drinking. Like, why didn't I think of that?
Yeah. I mean, and that's I remember I had another counselor once he was like an older gentleman. And he just would always just say like, holy Toledo. Like, he would be like, how much he was like, did you drink last night? And I'd be like, yeah. And he'd be like, holy Toledo. Mm-hmm. And he'd be like, how much did you drink? And I'd be like, pretty much what I usually drink, like a fifth of vodka. And he'd be like, holy Toledo.
Interesting.
Yeah.
Interesting.
But I finally ended up in a treatment center in Greensboro, North Carolina, called Fellowship Hall. And that's when I really kind of got, I'd been introduced to recovery before then, but was not ready yet. I was still in that like, pre-contemplative phase, if that, but when I got to Fellowship Hall, I was definitely more in that action phase. And my counselor, I remember, he was in recovery himself, and he basically said to me, I'm not here to tell you that you're an alcoholic. He was like, that's for you to figure out. But your story sounds very similar to that of an alcoholic. And then he also said, I'm not here to tell you that you can never drink again. He was like, you can always drink again. That option's always on the table. He said, I'm basically just here to try and help you understand that you're always going to have the same consequences. And so for the first time, like, somebody put the ball in my court and kind of introduced to me the fact that I had I could be an active participant in my own recovery. And that really, like, I don't remember it kind of like flipping the switch in my head at the time, but in hindsight, I remember that being like a pretty pivotal moment for me. And so I think there's a lot to be said for like genuine empathy with patients, actually listening to them, motivational interviewing. And another thing I have to come to terms with myself is that just because something worked for me doesn't mean it's going to work for everybody. Like, I have my own biases over the avenue I took to get sober. And I always have to like understand that just because that worked for me, other people have to find their own journeys as well. And I have to be open to listening to them and do what I can to help them along that pathway as well.
Right. And so I worked at an addiction center up in Connecticut. It was one of my favorite experiences prior to medical school. And I worked in a halfway house. Big part of my role was I drove this like, we kind of called it like the short bus. We used to always make jokes. So I used to drive a lot of the individuals from the halfway house down to AA meetings. And so I've been to like a ton of AA meetings, and it's, and I have a lot of respect for AA. And I have been to some wonderful AA meetings, and I think there's also some very shitty AA meetings, right? And so I've worked with and talked with a lot of patients who thrive in AA, and there's definitely some who just don't dig with it, right? Mm-hmm. And there's this one stat that I always love. Like, out of all the people that got sober, think it's like 66%, roughly 2/3, use the AA system and methodology, but the other third still achieves sobriety without it. And so I would talk to these clients, and we were in a rural part of Connecticut. They would talk a lot about how, look, this is amazing. There's 1 million AA meetings all around this area, quite a bit, because there's a lot of recovery centers. It's very cool. There's no other options. So can you speak on that? Like you mentioned how, your experience, you thrived in the AA environment. Like, why did you thrive in the environment? And what can we do for those individuals that, they want to try something else besides AA?
Yeah. So for me, I also felt like that's what you did. 14 years ago, one of the things I should say is when I was first trying to get sober, I was, I would end up in a detox facility. They put me on camp. I'm going to use some of the terminology we use. They put me on camp raw. I tried that personally. Didn't really feel like it helped with the cravings. And also you have to take 2 pills 3 times a day, which I always had a hard time taking that.
I think
that
that's
dose
everybody.
I tried Antabuse or disulfur. Is that it? Disulfiram. I haven't used that term in a while, but I tried that 3 times and drank on it 3 times.
Oh, you did?
Yeah, it was
projectile vomit crazy.
Not projectile, but there was plenty of vomiting.
Okay.
And I learned that you can essentially drink through it.
Wow.
If you're stubborn enough, there was once where I was on the Antabuse, went to a liquor store, drank I should say drinking and driving was definitely a part of my story. It's not something I'm proud of.
Right.
But it was, to this day, it still boggles my mind how some people practice safe behaviors when they drink, because it was just so foreign and absent to me, the way that I drank. And I have a lot of respect for the people that do those things. I remember being in med school and, seeing some of my peers who would, work hard, go out occasionally, drink responsibly, have 1 or 2 over an extended period of time with food, and, drive home in a very clear-headed state where they were not at any danger to themselves or others. And I just was like, man, how do people do that? It just did not resonate with me. Luckily, I never hurt anyone else. It's something that, again, I'm not proud of it at all. It was something that was just absolutely stupid and reckless and irresponsible. But what the heck were we talking about?
Well, let me push you here.
Yeah.
So why did your personality traits, and maybe it didn't even happen right away because you said you kind of had to go to a few treatment facilities. Why did you eventually really accept or work the program, as it's always said?
Yeah.
So let's start there.
Yeah. So yeah, for me, what I was kind of getting at was I had heard of 12-step recovery and just kind of thought that that's what you did. And so I tried some of the other things like the Camprol, the Antabuse. It didn't work for me. I was ending up in detox facilities. I ended up in my first treatment center, which was actually in Pennsylvania, and got out. And every time I got out, I would go back to drinking. I could stay sober for 3 days and then I would relapse. And I was introduced for the first time to 12-step recovery meetings when I was in a detox facility. I was in West Virginia, in Morgantown, West Virginia, and I'm very thankful to the facility there because I was introduced essentially to meetings at that facility. I'd been to some other detox facilities where, they didn't really talk much about 12-step recovery. And it could be that they talked about it and I just didn't hear it because I was just not in
It's
the
almost
state.
hard to believe that they wouldn't. I feel like it's almost everywhere.
It does seem like that.
Yeah.
The first time I was in a detox facility, I don't remember much.
But I do know some treatment centers are hardcore big book 12-step and others aren't. Right. So sorry,
very
go
true.
on.
But for me, I kept ending up in these facilities, and then they would take us to meetings, and basically what I was doing was not working. And I was just again, kind of like going through that period of hell where I would go to a facility, I'd get out, I'd relapse, I'd like move back in with my dad at this time. I was getting drunk and going to meetings. I would go to meetings and have liquor in my car to drink afterwards. And like, I didn't know what to do. But I felt like the answer was there. Like, I just hadn't quite surrendered yet. And eventually I had enough. And I ended up at the treatment center in North Carolina. And for some reason, I just started doing the things they asked me to do. Like, they said, you should stay here after you're done with your 30 days and you should move into our halfway house. And I just said, okay. And so for me, that was like the surrender process where I stopped fighting. Like, I said, essentially, I don't know what to do. I'm willing to listen to you all. And they started telling me what to do, and I just did it. Like, they took us to meetings. They said, go to this halfway house. I said, okay. While I was at the halfway house, they took us to meetings. They said, get a sponsor. I just said, okay. And then I talked with my sponsor and did the things he told me to do. He said to call him every day. And I just said, okay, and my thought process was essentially, I'm going to do everything they tell me to do so that way, when it doesn't work, I can tell them, essentially, screw you, and I'm going to go back to drinking. And I stayed sober for about 4 months and then stopped listening to them. I was like, I'm good now. I'm going to go back to West Virginia. I'm going to start playing in my old band again, get my old job back, basically just do everything I was doing before and magically stay sober now without doing any of the work that you all told me I should be doing anymore. And that didn't work out. Like, I tried moving back to West Virginia, moved back in with my dad, quickly relapsed, quickly was lying to him again. And essentially I got up one day, finished off like a third of a fifth of vodka and packed my shit up and then just like drove back to North Carolina and called the people, my friends in recovery, up and basically just said, like, I'm back, I need help. And they said, don't drink, show up at a meeting tomorrow. I picked up a start over chip and moved back into a recovery house. And that was September 30th of 2009. So that time around, I really made the commitment again of like, I'm going to do everything they say so that when it stops working, I can say, like, it doesn't work for me. Like, everybody can give up on me and I can go back to drinking. And essentially that was 14 years ago and it's still working for me. So, yeah. And I get that it doesn't work for everybody. And that's something that I have to be open-minded about as well. But to what you said, like, you're right. There are, not every meeting out there is going to be like everybody's cup of tea. And so that's why it's always good to check out multiple different meetings. Like, one of the things I suggest is trying 6 different meetings. Like, don't go to the same meeting 6 times, but try 6 different meetings before you kind of say, okay, this isn't working for me. And if it doesn't work for somebody, that's fine. Like, we actually, in our literature, it says, like, we don't really claim to be like the holy grail of recovery. And we're essentially just there for the people that want to use that avenue of recovery.
Right. I think the beauty of AA is that it's just been so, what was it established with Bill Wilson? Like
back in like the 19, it was earlier than that, like the 1930s. Yeah.
And it's just, because it's been around now for almost, 100 years, it say what you want about it, the 12 steps or not, it is such an incredible large community. And I feel like that's in my opinion, and I know I'm not an individual necessarily who attends AA meetings, but the healing aspect of a community, I think, is the strongest element. So perhaps maybe those remaining 33% that doesn't really align with AA, but they are able to achieve sobriety, maybe they're able to find some sense of community in some other avenue, maybe through church or volunteerism or through activity or hobby or something like that. I'm not really sure, because I've met a lot of other people who I worked with. I was like their I forget what my position was called, like outreach coordinator. I can't even remember. But it seems like a lot of them who did extremely well also kind of like switched their unhealthy addiction into a healthy kind of addiction kind of thing. Do you resonate with that at all?
Yeah, a little bit. Like, some of the stuff that recovery did for me was it did give me a community, which I needed at that time, especially in early recovery. I needed to be around other people who were actively trying to not drink and not do drugs. I needed that safety net. And I was living in a sober living house, and I needed that back then. Like I contribute a lot to that sober living house and the guys that I lived in that house with. We essentially like saved all of each other's lives, like having a safe place to go home to where, if I came home drunk, I essentially wasn't going to have a place to stay. Like the rules were, if you drink or use, like you got to move out. And, I'm not a very street savvy person. So I would not have done well if I was like living in North Carolina, trying to call my parents up and be like, hey, I got nowhere to go. We held each other accountable, and we also, essentially like, we supported each other. Some of the rules were like, you go to meetings regularly. And, we would keep lists of like the meetings we went to and kind of hold each other accountable. And that worked out really well for me. And that was exactly what I needed. I needed that community of people. And then the other thing I had was like, role models, essentially. Like, I could go to meetings and look at other people. And, when you have like less than 30 days under your belt, you look at somebody that has like 2 years and you're just like, holy shit, like I can't even imagine that much time at that point. And that's how it works. Like, I went to a meeting, I saw a guy who was my age, had been sober for like 2 or 3 years at that time. He seemed really happy about being sober and I wasn't. And I was like, hey, I kind of need some of that stuff that you got going on. Can you show me how to do that? And he was like, absolutely. Like, this is what you're going to do. You're going to call me every day. We're going to meet up once a week and we're going to read from this book. You need to work on developing some sort of relationship with a higher power. You need to go to meetings regularly. And so it gave me what essentially we call like, internal locus of control. Like I got to be an active participant in my recovery. It gave me things to do, to work on. And it also helped me to essentially learn and grow as a person and kind of give me essentially a blueprint for life that I just always felt like I was missing. And so, some of the things like I fully believe I'd be dead by now if I hadn't gotten sober when I did. And everything good in my life that I have going on for me right now is a complete result of getting sober. And so, anytime the thought ever comes across of like, oh, I've been sober for 14 years now. Like, am I okay? Is that something that I still need to keep doing? I have to remind myself, well, if I stop doing these things, then I need to just say so long to like all the good stuff I have going on in my life, because it's all a result of me getting sober and following the path that others followed before me and essentially just kind of helped point me in the right direction for.
Paul, one of the themes that I commonly see when we talk about the world of addiction is I see people who have used substances, have recovered, and they always seem to have this desire, this intrinsic desire to kind of reach back and to help others to achieve that same kind of sobriety. what is it about addiction that gives somebody who's able to recover that internal drive to help somebody else achieve the same goal?
That's a great question. And, you know, I wish I knew. Like I'm not quite sure if it is intrinsic, but it is something that is like, I think for some people it is intrinsic. Like they overcome their addiction and they want to help others. For me, it wasn't so much of like an intrinsic drive of like, yeah, I'm sober, I want to go out and help others. But I was taught like, you know, you keep it by giving it away. Like that's part of what we do. We help others. And, you know, I've always been available to help others. You know, when I was in med school, I disclosed me being in recovery to the counseling services there and let them know that if they ever had a student that wanted to talk to somebody and felt comfortable disclosing themselves or talking with another student about it, that they could give them my information. And they always did it like appropriately. They would like ask me if they could give my information to that student so that that student could then reach out to me. They never gave me that student's information. You know, I did get involved at one point with taking meetings into the jails in the area I was in. And, you know, essentially like going to meetings and I've taken meetings into detox facilities before and spoken at like my old treatment center and some other treatment centers. And so I have gotten to help others by sharing my story, which was a goal of mine. But yeah, for me, it wasn't really like, it's kind of and for me, it's been a byproduct of it. Like I got sober, recovery started giving me like guidelines and suggestions on how to be a better person, and kind of a sidebar of that was that I kind of started feeling like, oh, I'm feeling better now. I want to help others.
Okay. Paul, so let me ask you this. You're very open about your past, your recovery. Do you ever worry that it may, you know, disclosing this information on a public platform like this, I mean, is there ever a thought that comes across your head that says, hey, maybe this might affect me professionally? There is stigma against alcohol use and all different types of substance abuse, right? So is that something that you have previously experienced or that concerns you to this day?
Absolutely. And one of the reasons why I am comfortable, like I would not suggest that somebody who has, you know, been free from drugs or alcohol for, you know, 3 months, like, and is like in the medical community to like come on a podcast and like openly talk about that. You know, I do feel like, you know, we are kind of heading in a direction with certain professionals, and I, you know, like to think that the medical community is heading in that direction as well. You know, similar to what I've seen Logan share about his own, you know, his own journey with bipolar disorder, that it is becoming a little bit more destigmatized in the medical community. That being said, you know, it has crossed my mind. You know, I do like to be able to be open about my experience, and completely came on this podcast free of my will.
And we're not paying you.
And I'm not, yeah.
We didn't tell you that part yet, but here you go.
Yeah. But that thought did come through my mind. Like, is this going to be a bad idea? And so one of the things I've learned from recovery is that I ask others about the things that I'm not sure about. So, you know, I talk to some other people in the medical community that are also in recovery themselves and asked their advice, and basically said, like, do you think this would be a good idea, or do you think this could impact me negatively? And then the other thing I wanted to do was make sure that I was also doing the right thing within the recovery community itself, because there is the concept of anonymity, which I am a big fan of. And being a big fan of anonymity, that means like I don't have to disclose myself to everybody I come into contact with, but I do have the ability to disclose me being an alcoholic when I feel like it has the potential to benefit others. And I feel like this kind of platform, especially a psychiatry platform where other young budding psychiatrists, medical students, residents can listen to this and hopefully use some of this information to help better engage their own patients that are possibly struggling with substance use disorders.
Or themselves, right?
Or themselves.
Like Joon was telling me about an insanely tough case that he had to deal with recently. And like how many healthcare workers can relate to that? And so we were kind of discussing like, shit, when we deal with those really challenging cases, like one thing that I use, and I know Joon does too, like intense exercise. Like that's how I feel like I have to break that negative thought pattern, that negative emotion. But even you highlighted in your story, right, that like an easier way than exercise sometimes in a sense is hammering your substance of choice, right? And health, I don't have the stats of course in front of me, but I think it's safe to assume we can say healthcare workers are at increased risk of substance use, right?
Absolutely.
And so that's why I'm just so thrilled that you are willing to do this, right? Because I know it's hard, and also embedded in the sober community, recover community is, Alcoholics Anonymous, right? Like that anonymous component, which, I respect and also partially disagree with simultaneously, right? Like I think it's so important to be anonymous, but also having someone that can speak out can also have so much power too. And like, I always like find myself asking like, why does it need to be anonymous, right? Like so many people can relate to substance use, like everyone in every single family, I feel like, probably has an individual that lives with substance use disorder in some capacity. It's everywhere. We all need to start talking about it more and more. So I just, I'm so proud of you for doing this for our, 150,000 listeners per episode, maybe 200.
200,
yeah, maybe something like that. We're coming up on 47 minutes here. This is about when we like to keep each episode. Is there anything that you feel we haven't touched upon about your alcohol use disorder that you feel is important that you want to really share?
Yeah. Kind of, going along with like what we were just talking about anonymity, and, speaking up at times, I'd like to say that, personally, I'm not a member of like a PHP program, but I would like to say that I've known people within the medical community that did get help through different like PHP, like physician health program, programs that are different, like within different states. When I was in med school, I did reach out to the West Virginia PHP program and like disclosed myself to them, told them my story. At the time I had like 7 or 8 years sober, and they basically said like, keep doing what you're doing. Like, we're not worried about you. Like, they're always like, they're really concerned in like those first 5 years. And they actually have really great like statistics.
Yeah.
Cause essentially like you're monitored pretty closely, and, your license is on the line if you don't follow like, the program that they give you. But for them, like they tend to see like upwards of like 95% like success in like those first 5 years. Like, I'm like, don't quote me on that stat, like, but like, I think it's somewhere around that. So, that's definitely something that is out there. Again, like I don't personally have experience with it, but I have, worked with other people. And I actually worked in a recovery center for a while as well. It was actually the one that I went to North Carolina for. And I got to work some with physicians that came in with substance use disorders. And so got to see some of them work with the PHP programs in North Carolina. But one of the reasons why, I try and be a little careful when it comes to disclosing myself, it's like, let's say somebody is listening to this podcast and they don't have much experience with 12-step recovery. And then, they hear me talking about being a member, and then like a week later they see me in like the newspaper or like on a news article on their phone that like, I got drunk and did something crazy or something like that, then they might think, oh, like that's what happens to those people that go to that thing. And so that's one of the reasons why there is a little bit of like the protection of like the anonymity. But I do think that there is a little bit more, we are heading in a little bit of a direction where it is becoming a little bit less taboo. And, again, like it started in like the 1930s when, like most people knew everybody else's business within the town that they were in. And so, it's something that like I don't like, post on social media, or again, like I don't, go out and like tell everybody I come in contact with, like, hey, by the way, I'm Paul and I'm an alcoholic. But when I do have the opportunity where I can try and help others by telling my story, then that's something that I'm completely comfortable with and always happy to be a part of.
Awesome. Paul, before I close this out,
I would like to ask one more question.
Me too. I have one more question. Logan, you go first. I'll hold off.
Well, one of my new favorite aspects of psychiatry is psychedelics. I've been doing a lot of reading. The month of October, I'm on a psychedelics research experience, just trying to really become as much of an expert as I can. I'm really thankful that Rowan has given me this opportunity to educate myself. And, I've known this actually for a long time. I'm sure you know what I'm about to say.
Yeah.
Bill Wilson supposedly at least had... I don't know all the facts here, and maybe no one really knows exactly the facts, but an experience on LSD that inspired his AA start of this community or the book. I don't even know exactly. But, what are your thoughts on psychedelics for alcohol use disorder? Have you read the psilocybin study recently for alcohol use disorder? Like, what do you think is the future of this?
I definitely think that there's potential there. I personally am a fan of like MAT, again, like motivational interviewing, trying to meet the patient where they are. If somebody is interested in like using Suboxone or methadone, if they want like Vivitrol, like if they want to try, like explore, like trying psilocybin, like whatever it takes to help that individual. And yes, like I have heard that Bill Wilson, did some experimenting with acid in his days with, kind of working on his own like spiritual experience. And again, it kind of comes down to like within the recovery community, like it's their suggestions, their guidelines, like for people to take what they want with it. For me personally, it's not something that I see myself exploring since like I have.
What that wasn't what I was asking.
That wasn't the question.
You're already in recovery. You're doing extremely well.
Exactly. But yeah, I think it's I'm curious to see more about it. Like I haven't read as much as you have about it. I'm still kind of, being 1 year behind you guys, I'm still kind of like getting my foundation and things like that, but also like exploring some of the avenues that I find interesting. But that is something I want to learn more about. Before
you ask your final question, Joon, disclosure for the audience, that study that I referred to, psilocybin helping with alcohol use disorder, reducing binge drinking days, and number of days drinking, very fascinating. I think it was in the JAMA Psychiatry, but I don't remember off the top of my head. But key here is the setting. This is not just individuals taking psilocybin and boom, they're fucking better. It's in the proper management of healthcare professionals in a therapeutic setting, working with a therapist throughout an experience. So please interpret that in the right way. Okay, that's what I'm saying, and we'll have another psychedelic episode. Go ahead, Jim.
All right, Paul. All right, so we've thrown out several different terminologies during the course of this conversation. You yourself refer to yourself as an alcoholic. We've also thrown out the term alcohol use disorder. I've never been to an AA meeting before, but when I think about AA meetings, the things that I've seen on TV and before, I always imagine somebody going up to that podium and saying, "My name is Joon and I'm an alcoholic," right? I've never seen somebody say, "I'm somebody with alcohol use disorder." So I feel like in those settings, they're very intentional about the words that they use. So my question to you, Paul, is there a consensus upon, in that community as far as like, do you guys view the term alcoholic as stigmatizing?
So, I mean, that's a good question. I feel like a lot of people that are in recovery and go to 12-step recovery meetings, like it's not much of a conversation with us. Like, most of us are comfortable yes, that is what we call ourselves in meetings. That's what I call myself. Like everybody, like all the meetings I go to, that's what everybody calls themselves. But I think within the professional community, it is important, and words are important in the professional community, especially with psychiatry. And I think I appreciate within psychiatry, that's one of the things I like about psychiatry is there is a level of empathy within our specialty that, not to, diss on any other specialties, but I think is a bit unique to psychiatry, that we, like, that empathy is so much like in the forefront of our minds, that we care about the patient and how they what they want to be called, what kinds of terminology they want to have used, like what kinds of pronouns they want to have used. If a patient tells me, like, don't, refer to it as alcohol use disorder, call it alcoholism, I will perfectly be happy with, doing, like, abiding by their request. I would not, in a professional setting, talking with a patient, refer to them as like an alcoholic or an addict without them giving me that permission. And especially if it was somebody who was like more naive to that terminology, I would absolutely stick to like the professional DSM criteria that we use with patients, like referring to substance use disorder, referring to opioid use disorder, whatever it be, in those settings. Yeah.
Fair enough. Thank you for sharing your insight.
Mm-hmm.
Thank you for spending the evening with us. And thank you for sharing your incredible story. I do think it's super brave for you to disclose everything that you have in a public setting like this. And I did mention earlier that I feel like, when I see somebody who's made that recovery, I always sense a drive to reach back and help other people. Mm-hmm. And I think in many ways, that's what I see from you, Paul. Your ability to articulate yourself in the ways that you do, your ability to just be honest and just be straightforward, about your experiences. I think it's going to be tremendously helpful for the people listening on this podcast. And I really believe that the patients that you're going to end up taking care of in the future, and the ones that you do take care of right now, I think they're better off for it because of your ability to empathize with them on a different level, because of exactly the experiences that you have had in the past.
Well, thank you. I appreciate it. And thanks for having me here.
All right.
Smash that like and subscribe button. Subscribe with your friends. Okay.
All right. See you next time.